benefit in my medical training of training in a children's hospital, because Johannesburg used to have a children's hospital, the Transvaal Memorial Hospital. And it was a hospital which, under the old dispensation, served only a small percentage of the population. And my dream was that we should have another children's hospital that would serve children who have need for care, unrelated to any color, race, creed, or financial situation. But unfortunately, life, and when you get to my advanced age and you look like Father Christmas, life is not about dreams. Life is about finite realities. And so I was asked, and I could be one of any of the academics in the local environment, because I'm an academic pediatrician of some 40 years standing. I've worked 17 years at Chris Hani Baragwanath Hospital, and I've been at Rahima Musa Coronation Hospital for the last 15, and so on. So I've been around, and I've served mostly South Africa's black children. And we had this finite need to create a hospital that wasn't as what we would have liked, a big comprehensive 1,500 bed pediatric hospital with all levels of care, but a smaller, more importantly, tertiary, quaternary hospital dealing with some very specific needs that were falling off the table. And I think that if you ask me how this hospital is going to serve the pediatric community, the children of our region, our SADC region, and our province and our city, I would say to you that there are 4 important areas. The first area is service. The first area is individual care. Children with severe illness, kidney failure, congenital abnormalities, leukemia, those kind of things will get individual care unsurpassed anywhere in the world. We've got the expertise, but unfortunately the facilities for providing this care have not been matched over the last 10 years or so, as the cake has been correctly divided and given more towards primary and secondary level care. So individual children, let's not lessen the importance and the needs for caring for those children. But there are bigger and more important things perhaps. The next thing I want to say is this hospital will serve outreach into the community. So there will be an outreach, a medical outreach, an ethos that is created in the care of these children, in the excellent care we hope to deliver, that will go out. We will go out to fetch children, okay, to our hospitals, to stabilize them and fetch them. And in doing so, we will take some of our ethos and knowledge with us to our referral axis. And so that would be important. Perhaps even more importantly, we intend bringing people in for training. There are only 20-something pediatric surgeons in the country, a country of 45 million or however, and we've got so few pediatric surgeons. So one of the first priorities will be training, not only of pediatric surgeons, but of pediatricians and pediatric subspecialists like pediatric oncologists, pediatric radiologists, and so on and so forth. We can't underestimate the need to train nurses to look after children. And this hospital will be a fertile ground for training of pediatric nurses. There's such a shortage of nurses in our country. A lot of that has got to do with inadequate facilities to train them. And here we're going to particularly concentrate in training nurses. And then there's the research. So we need appropriate African research for African children. It's not possible nor correct to apply all the Eurocentric and European and North American standards onto our children. We need appropriate research for our children with their diseases and the nuances of their diseases. Pediatric children's leukemia is not the same in African children. It needs research to identify that, and we're already doing that research. And this hospital will be intimately related to the university locally and to the universities in the region, and we'll be able to provide that appropriate research. So those are the sort of contributions I think that this hospital will make. But it comes at a time of constraints. The first constraint, I think, is the global economic downturn. And it's up to, and that won't last forever. Praise the Lord, I think it'll get better soon. I'm an eternal optimist. But we need people like yourselves to go out there and conscientize people to raise the money in these tough times so that we can get our $1 billion for CapEx and get this hospital built to be the superb hospital it will be. I'm happy to say the other constraint that I wanted to say something about was HIV/AIDS. Our country faced a tremendous burden at the time of democratization, was at the time of the emergence of the AIDS epidemic, and we've spent so much of the last 10 or 15 years concentrating on HIV. But I'm happy to tell you that I came from a meeting this morning where we looked at my hospital at HIV and at the South African figures for HIV, and the prevention of mother-to-child transmission is working. We're seeing far fewer children with HIV. Those that have got HIV are on treatment. We're seeing tremendous numbers of children being put onto treatment and being managed and converting this lethal disease into a chronic livable condition. And so I think we are overcoming some of the other important health priorities. And I think the development of a tertiary hospital for children is an idea whose time has come. Thank you.